Stephen Klasko. Everyone loves Stephen Klasko because he's out there. He speaks in the future. He lives in the future. He speaks in the future. This is what he has to say. This is healthcare's Amazon moment. If you are a provider and you think you're going to go back to your business model solely being based on hospital revenue and not relevant to people who want care at home, I think you will end up out of business. If you are an insurer and think you can just be the middleman between the hospital and the patient, you will become irrelevant. If a hospital believes that innovation can be just a little cute thing that they do in the background, but the real business is just getting heads in beds, they're nuts. I think we're always wondering what the big disruption would be that got us to join the consumer revolution, and I think this is it. Since I don't have my glasses, I'm going to increase the font size here so I can read it a little better for you. I love that. I think that's what we're going to be talking about next. He's absolutely right. This is one of the things we're going to be talking about going into next year. But in fairness, we've been talking about this. When's the digital revolution really going to hit? When is the hospital model going to change? When's the payer model going to change? Who is the most relevant in the model? Is it going to be the insurance, the payers? Is it going to be the providers? Is it going to be the IT startups? Regardless of who is going to win out in that, he's right. Some things have changed. Expectations have changed. And if expectations have changed, then we have to keep our eye on the ball and understand where expectations are going. BJ Moore, CIO Providence, he's talking a little bit about their Microsoft thing, Microsoft partnership. He said, from the beginning, we defined this within our strategic framework of simplify, modernize, innovate. I love that in and of itself. Simplify the environment, modernize the environment, innovate around that environment. In fact, innovate is really hard to do if you haven't simplified and modernized. It's almost a continuum. In the innovate space, we are focused on the future of care delivery, a future that has the patient, not the site of care, at the center, with innovations on how care is delivered. For example, around telehealth and home monitoring scenarios, and innovation on the way we enable care providers for greater experience and outcomes. An example emerging from the collaboration with Microsoft is natural language processing in cancer treatment. So much wisdom here, and BJ Moore will be on the show again, probably February, March timeframe. I think it's already scheduled. I love this. In the innovate space, we focus on the future of care delivery, a future where the patient, not the site of care, is at the center. And I think we're going to see the locus of care change, and that will require us to rethink some things. We will see more stuff go to the home. We will see more things go outside of the hospital. We will see more care at a distance. I think those are givens just based on what we saw during the pandemic, and the pandemic's not going away. It's not like we're going to start January 1st, pandemic's gone away and we can go back to normal. This is going to be something that will go on for a fair amount of time, and because it's going on for a fair amount of time, it's creating new habits. New habits form in about 30, 60 days type thing. Well, this has really hit us and changed the way we operate since March of last year, and it's probably going to go. Most people I'm talking to are saying at least July before we get some semblance of normalcy, but more than likely through the end of the year is what I'm hearing. So a lot of new habits are going to be formed, a lot of how people, their expectations we already talked about. So we're going to have to look at delivering care in different venues in different ways.